Welcome to the Modern Biopharma podcast. The world of today's medicines is big, complex, and constantly changing. Our goal is to give you insight into the people that are manufacturing the medicines people need every day, whether it is the people taking care of these facilities, or those building them, or those maintaining the quality and integrity of every dose that is delivered to the patient. We interview the people that are making it happen and give you a chance to get to know them while we're at it. Thanks for saying hi.
Hey everybody, welcome to an episode of the Modern Biopharm podcast. Today we are excited to have Kevin Mitchell on the podcast. Kevin is a friend of mine that we operate in this industry up here in the Boston area. Kevin works in ISPE, volunteers, and that's how we met. So I'm excited to talk to Kevin today. Kevin, welcome.
Hey Jesse.
Hey,
thanks for having me.
So we are both here at our home offices, bunkered down for this COVID-19 time. We're all dealing with this separately in our own ways, but Kevin and I are both at our home office. How's yours treating you? You have a nice new one. I do too. You liking it?
Yes, I do. Yeah, got a new house a couple years ago, and we had them finish above the garage, which I think is the same as yours.
Above my garage, above your garage. Nice.
Yeah, I got my world map behind me.
Yeah, yours has been done.
I didn't do any of the
decorating.
My wife did that.
Well, you can see my decorating. There's nothing there. So awesome. Well, Kev, we're just gonna get started. Go through some of these questions together. So if you could just give everybody a little bit of idea of who you are. On your personal life, actually, it'd be nice to just get to know you a little bit.
All right. Let's see. I was born in Concord, Mass. I don't know if I want to go through my entire life, but
yeah, we don't need to know how much you weighed when you were born or anything. Yeah.
No. So currently, I am a dad of 4 children. I homeschool just like yourself. Well, I don't homeschool. My wife pretty much does all the homeschooling. I'm kind of more of the dean. I kind of put my foot down when there has to be some new rule or something to put into place. But for the most part, my wife handles all the teaching and administrative work of homeschooling. We got 2 dogs, not nearly as many dogs as you have. I know you just had a litter of dogs, or 2.
Oh man,
right?
We don't need to talk about too much about my dog stuff. Yeah, we got dogs.
So Jess has got dogs. We got dogs, and been married now for 20 years. We live in the Lakes region of New Hampshire, and I like it up here. I know Jesse wanted me to move out to Hampton Falls area when we were trying to find a house. We just couldn't find anything that would be in our price range that would fit us.
Yeah.
Having 4 kids, it's tough. So that's where we stayed out here. We love it. That's where all my kids' friends are. That's probably been the toughest thing right now for the COVID-19 has been them not being able to hang out with their friends.
For sure, yeah.
Same goes for me, not being able to see my customers, and some of them are my friends. So it's tough not being able to go visit them and see them right now. So
well, thankfully we get to hug each other virtually through the
virtual hug. So
awesome.
You can edit that out.
This is the real deal. Well, this is good. For those of you guys that don't know either of us, Kevin and I are kind of like brothers from another mother. We share way too many things in common. So I have an extra kid, but we're got a lot of things going on the same in our lives. So all right, cool. Well, just to get right down to it. So tell us a little bit about your history in the biopharm industry, sort of where you came from, how you got here to where you are now, and what you're doing.
I pretty much grew up, I wouldn't say in the industry, but my father worked at Integra for over 40 years. And they were kind of, I guess you can use the term pioneer, vendor or supplier to the biotech industry as it kind of grew. They supported, food and beverage, industrial all different types of industries with hose assemblies and anything, tube assemblies, hose assemblies. So with that, I started working in sales at a company in Nashua that had nothing to do with the industry, but they helped put me through college, pay for college, and then I got an offered a job to work at inside sales with Integra back in 1998. So back at that point, they were already in the biotech. The industry was growing, so I was putting in orders. Then I go out at the end of the day and make hose assemblies and tube sets. I used to work with. At that point, it was Leighton Terwilliger was there.
Oh, Leighton.
Yeah, he used to make hose assemblies for Lonza. The old used to be Wyeth, now it's Pfizer, and TKT, which is was Shire, now Takeda. So kind of dating myself there, but basically that's how I started. And then I went to a company, SF Medical. They were a silicone manufacturer. They did liquid injection molding, extruding tubing, hose assembly, hose. And I was at one point their national sales manager. So I worked there while, my wife and I were, how the balancing of family and work kind of came into play there, because I was traveling all the time. And it wasn't local, it was California, it was Europe. And we were, we were expecting our second, and I was in California, and I missed one of those prenatal visits, and we ended up having a miscarriage, and that was tough. So that kind of changed what I wanted to do and where I wanted to go. Fortunately, I was able to go work for a supplier company, Howard Precision, that was based up down in New Ipswich, New Hampshire. And then we opened up a division up here in the Lakes region. That's why I'm up here. And I worked there for 13 years as a director of sales.
And that's where I met you, right? That's where you were when I met you.
Yeah. So we were a manufacturer. We kind of specialized in, all types of stuff, but machining, custom sanitary parts, sanitary fittings. And that's how I got to know Tech. And I was offered a job to go to work for Tech a little over 3 years ago. And it was just time, it was a good parting from Howard Precision. Working 13 years is a long time in a small family-owned business, kind of taking it from that mom and pop shop and being a part of it as it grew to a much larger business. So that was fun. I learned a lot, able to put everything that you learn in school to practice, wearing every hat in the business. So it was kind of invaluable for me, for my career. So now I've been at Tech now for 3 years, about 3 years, and it's been great company. They've been around for about 40 years in the industry. They're kind of like an Integra. They've been more on the process side, stainless steel. That's why they're Tech Stainless. But they also have a ISO Class 7 clean room and, hose shop and stuff like that. So,
so
that's my history in the industry where I've worked.
But you definitely have grown up in this industry in New England specifically. Has been most of your background. Now, where you're at Tech now, you represent a lot of different kinds of products and pieces and things. Can you give us a little idea of what you like to focus on?
Well, at Tech, when I first started, they knew my background. I had known the president of the company for now it's been 25 years. So he wanted me to focus on the Biopharm. So my title is on the Biopharm and hose product manager. So that's pretty much where I hang my hat every day. The healthcare industry. The only time I get into other industries is I also call on customers down on Long Island. And I was actually supposed to go down there a couple of weeks ago, and that got, they had kind of a pretty serious outbreak of COVID-19 on Long Island. So that got that was kiboshed back a few weeks ago, and then I've been stuck in my, well, I wouldn't say stuck because I do like my office, but pretty.
You're really suffering there in your office, huh?
Yeah. It's and I feel really fortunate just because of the timing of things and being homeschooling and having the office. It does make it nice.
Yeah.
But
so
yeah.
you've been around a lot in the industry. What do you see as some of the changes, maybe either across the industry or maybe even specifically with the kind of things that you worked with? What kind of changes have you seen over your time in the industry?
Well, besides what the actual biotech customers are doing, what I've seen, the products and services that we offer they just kind of get better and better, just like the processes get better and better. They kind of come up. Used to be everything was stainless. Everything was big stainless tanks, buffer tanks, big. Everything was stainless with large bulk hose transfer. And then they started going into the bags and single use, and that started a good 10, 15 years ago. I was working with a few companies when I worked at SF Medical. We manufactured a lot of tubing that was going into that market. So basically it's as they're trying to develop new therapies and new products, they're coming up with better, more efficient ways to manufacture the product. And then it's nice to see the suppliers or the manufacturers or the distributors kind of partner with it's not, you don't typically see that in other industries where the suppliers partner with the customer to kind of come up with the best process and best way to do it. And like, I'm not an engineer, but I'll be sitting in a meeting and they're like, "Hey, Kev, what do you think is the best way to do this?" And I'm like, I'm definitely not the smartest person in the room. And they're asking me what I think they should do. And you're talking about millions and millions of dollars worth of product. And they're taking, my advice just because of, what I've done, hose assemblies. It's really just two fittings, a piece of hose, and there's just millions.
Simple, right?
It seems simple. There's just thousands of different variations, and it's trying to pick that right application, based on that size, temperature, application, media, pressure, and length. It's just asking the right questions to determine what they need. But for the most part, it's like any industry, as things progress and they come up with new products, new ways of doing it. It's been pretty cool to be a part of that.
That's great. Well, one of the things that's really neat about, when you're in sales or in sort of a role where you get to go out and visit customers, is you kind of have this exposure, right? I know I get it. I know you get it. You get to go to all these different facilities in different geographies. So you're going down to Long Island, you're handling mostly New England now, New York.
Yeah.
But in the past, I know you travel the whole country. So you get to see different methods of manufacturing, different types of manufacturing, sometimes different industries where there's a lot of overlap. So when you go into a customer site and you see some of the issues that you're dealing with, and you have a product that you're trying to help them with, what's something that you see as an easy win when you go into a lot of sites? So you go in and you see this thing, like, because you go to a lot of places, it seems like a lot of places are doing this and they could do this, and it would be a really easy way to just make an easy change that would give them a lot of benefit that maybe they don't see.
Yeah, it's one of those things that you asked me that to look at that question, and that's the only, like, all the questions you sent to me. That question, there's so many things that customers do and use. So because we supply, fittings and pretty much everything from your upstream, downstream, we have something that fits in there. So there's a lot of different products and there's a lot of different things and services. But what I'm trying to get at is that basically, if people would just go with quality versus price, go with something that, a lot of times they talk about, oh, I'm trying to save money. But things that are like BPE approved products, things that are, we have this ASME BPE board that they've come up with dimensions and surface finishes, and they partner with the manufacturers, with suppliers, with everyone. It's not just people trying to sell stuff, it's trying to come up with the best practice. So
right.
I try to encourage people who are saying, yeah, I'm having issues with this, with corrosion, with, sometimes I've tried to encourage people that, in a CIP solution system, that they're doing a lot of chemicals, that there's more and more access to specialty alloys like Al6XN
Yeah, that's a
and
good one.
Castalloy versus using 316. It might cost more, but in the long run, they're not going to have issues with corrosion and rouging and all that kind of stuff in their lines. And same thing with like hose assemblies, where they'll use platinum cured silicone because it's a go-to, it's easy, it works. But long term, you might want to go with a PFA or a PTFE hose that is cleanable. It's going to last longer. Yeah, it might cost more, but it's kind of like, it's going to work, and they're not going to have any issues. So those are the types of things that I'm involved in. And then
yeah, those are great examples.
Yeah. So where you're talking process, and then when you talk about connectors, when you're talking about like single-use assembly, there are really good aseptic connectors out there that are genderless, that are available through everyone. We have we're an integrated supplier with CPC. So they supply a lot. They supply to a lot of the single-use suppliers, assembly companies, and we also do that at Tech. We work with Kohler products. So
okay,
those are some really good products that, again, they might cost a little more, but in the long run, they're going to save you time and money long term.
Yeah, those are good examples. I mean, I come into very similar things. I've seen the change in alloys like you were talking about for CIP. Do you find that easy to help a customer sort of see where that might benefit them? Is it easy to define like that trade-off spot where it's worth it to go with maybe a lesser product, or do you sort of always try to recommend the more right product in that situation?
A lot of times, it's that, I guess it's that difficult thing in sales where I'm trying to be more of, I'm trying to give people information. I'm trying to be a resource. Yeah. I'm trying to partner with them, and I'll share with them what I think would be best. And sometimes I'm working with an engineering firm or with their engineers, and they're coming up with their process. Sometimes it's after the fact where they're saying, oh, they're having this issue.
Yeah.
So then I share, but so I try to get involved before the project starts. But a lot of times it's not, I don't necessarily try to push people. It's more like, hey, this is what I've seen. I'll usually bring in an expert from the from the manufacturer. Like if it's V&E, I'll bring in their alloy expert, and he'll sit down and do a whole lunch and learn on corrosion. And
right, you could talk about what's going to be involved. If you're CIPing with a stainless steel vessel, you're going to have this much rouge, and then you're going to have to use this many chemicals and this many times to get rid of that rouge, and this is a way to avoid that.
Yeah, exactly. So a lot of times I use the resources I have to educate, and I don't know. I know a lot, but I don't know everything, far from. So I will always go and I will access my suppliers and get the experts to come in to help.
All right, awesome. All right, so there's a ton of changes in our industry right now. It just keeps growing and evolving, and there's new and different kinds of therapies coming out that have changed the way we manufacture drugs. So what's something that you see, whether it's just in your own world, that you the kind of products that you sell, or more on the macro side? Like, what's something that you're really excited about that's a change and an evolution in our industry?
Well, you're in the industry, so you see it. I think it's awesome. All these new gene therapies and therapies are coming out for cancer.
Yeah.
I have family members that have cancer, and they're always just automatically it's chemotherapy or radiation, and that's a method, but they know it's not the best method. It works sometimes. It's basically poisoning the cancer. Hopefully, it doesn't poison you too much, and so it has the really difficult side effects to see your family member have to go through. So that's tough. But I think it's really exciting with that. What was the other one? I was they're using DNA. I just think that's with the gene therapy. They're finding folks that have these diseases and illnesses and sicknesses, and they use their DNA and they attack that. And I can't speak proficiently.
You mean like a CRISPR, like a gene? Is that what you're talking about?
Yeah, it's just amazing to see. I go in and I'll ask them what they're doing, and they will tell me what they're doing, and I'll hear it and be like, wow. And I can't repeat what they said because it goes over my head. So,
I think they always talk about, I'm not a rocket scientist. I think that we shouldn't even be talking about rocket scientists anymore. We should be talking about the people that are taking out a piece of somebody's gene and replacing it with something else. That it boggles my mind for sure.
Yeah, I think those are the scientists that are coming up with cures for these rare diseases and illnesses. They're amazing. These people, and I meet them every day, and they're kind of like my heroes. They don't think of themselves that way, but I think it's really cool to be a part of that and be in this industry.
Yeah, that's great. All right, so we're getting close to the end here, but I just want a couple more questions. So first off, the first one is, when you think about your work that you're doing right now and you're working in biopharma, you visit all these customers, and you know what you've done and what you are hoping to do in the future. What's something that you think you could like to tell yourself 10 years ago that would help you today, and you wish you'd known back then?
Well, I hate to say that it has something to do with a product that I could have invented.
Yeah. I wish I'd put $10,000 on Google. Yeah.
Google, yes. Yeah. Besides anything personal, but I think with all these new technologies that have come out, especially in the single use, seeing everything going that way, I think to have come out with or talk to myself in the past and like, hey, you should come out with this type of connector to really be able to service and help people. But other than that, I would have told myself to probably get more involved with ISPE specifically. Like, I think you talked about it. I've only been volunteering with the show committee for like this will be 4 years. And I wish I'd been doing this for 20 years. I wish I would probably have been doing what you're doing, being the head of the show committee, kind of worked my way and been really instrumental. And I think I can still do that. I'm not, I still got 20 years left. I'll be the old guy. I'll be the old guy on the board. But we're actually looked at, we're the old guys, because most of the folks that are coming in I know, I got the gray.
It's the gray.
Yeah.
I just shaved it all off. Nobody would know I had gray.
Yeah. I actually just trimmed mine, but it's still showing. Can't hide it anymore. So I think that's probably one thing I would do a little differently. And I think I would be, more involved directly with the pharma companies, like I am today. I think if I could go back, I'd be like, you need to get in there, find out what they're doing, learn, maybe even take some classes. And I'm actually looking at doing that. And I think if 10 years ago I took a couple courses on, biologics and things. I think that would have really helped me.
Just to better understand the actual end user's plight.
Yeah, exactly. Just to be able to help people better, because that's what I do. I try to help people come up with a solution that will best suit their process, and that's what I do.
That's great. Awesome. I think this is a question I think I'm going to get a lot of different answers on, but I'm excited to hear what other people have to say about that. So, all right, well, that's it. I want to ask one last question, and just to have you tell us if you have any other thoughts you'd like to share with our community as it pertains to the biopharma industry.
Well, right now, with the current situation with COVID-19, I think it's important that we all stay as safe as we can so we can stay well, protect our families. And then, because that's really our health, because we're in the biotech industry, that's all we do is we're trying to help people's health. Because if we're not healthy, we can't be the dad we need to be, the husband we need to be, if we're not healthy and strong. And so I think that's huge. And also, I just wanted to say thank you to everyone that's in the biotech industry, because right now they're in a fight to come out with cures right now for COVID-19 or treatment or a vaccine, and they're all hands on deck. I know from the financial side of things, they want to try to come out with something. It's like a race, but at the same time, I think if you were to have a meeting with these folks, they all are the same. They're all about helping people. They're trying to find a cure. They want to fight this thing and kill it. And they do the same thing when it comes to cancers or any other illnesses and sicknesses. So I think the last thing I want to say is just to all of them that are working right now tirelessly, putting in hours and hours of in efforts to find these cures, just say thank you.
All right, thanks, Kev. It's a big thing right now, and on top of all these efforts to go after and combat COVID, we're still making all the same medicines we were making before. None of that stopped. So it's there's no rest for the weary in this right now. So, all right, well, thanks so much, Kevin. I appreciate you being on today. I'm excited to share this with our world out in the biopharma industry, and looking forward to seeing you at our next ISPE event, which I'm sure will be, I don't know when it will be. It'll be soon. Everything's kind of on hold right now, but it'll be soon enough.
We'll have our next committee meeting. Maybe we'll do a Zoom meeting.
That's actually a great idea. I'll talk to the group about that, and we'll set it up. I think it's next week we're supposed to do it. So
yeah.
All right. Awesome. Thanks, Kev. Have a great day.
Thanks, Jesse. You too. Bye.
Thanks again for listening to the Modern Biopharma podcast. Please reach out if there is someone you'd like us to interview or a topic you'd like us to discuss. We will make it happen. And don't forget to like us on iTunes or subscribe on YouTube. It helps us get the word out. See you next time.